Your mother forgets where she parked a car. Your father repeats the same question again and again. It's easy to call it just aging, but sometimes, small changes are early clues to something more serious, something that may be managed more effectively if caught early. Vascular dementia is the second most common form of dementia after Alzheimer's disease. Unlike Alzheimer's, which is linked to abnormal protein buildup in the brain, vascular dementia develops when blood flow to parts of the brain is reduced, often after a stroke, a series of small silent strokes, or long-term blood vessel damage. What makes it challenging is this: the early signs are often subtle. Families may overlook them for months or even years, assuming they're normal age-related changes. By the time help is sought, more significant changes may have occurred. In the following section, we'll briefly review 8 early warning signs that adults over 60 and their loved ones should recognize. Important: this overview is for awareness only. These symptoms do not confirm a diagnosis. If you notice persistent or worsening changes, consult a qualified healthcare professional promptly. Let's begin. Number 8. Sudden trouble with planning or organizing. This is not about occasionally misplacing keys. It's about a noticeable shift in the ability to carry out familiar, step-by-step tasks. Imagine someone who has managed household finances for decades suddenly struggling to pay bills in the correct order, or someone who has cooked the same meal weekly for years now becoming confused mid-recipe. This type of difficulty involves what doctors call executive function, the brain's ability to plan, organize, and execute tasks. In vascular dementia, blood vessel damage often affects the frontal lobes, areas responsible for decision-making and organization. When blood flow is interrupted, these abilities can decline abruptly rather than gradually. Families sometimes compensate without realizing it. They step in to help, masking a change that deserves medical attention. If you notice a sudden decline in planning abilities, document specific examples and speak to a doctor. Number 7. Increased evening confusion. Some individuals appear sharp during the day, but become noticeably confused in the evening. They may lose track of the date, forget whether they've eaten, or seem disoriented in familiar surroundings. While fatigue can contribute to mild confusion in anyone, a consistent pattern of worsening cognition later in the day warrants evaluation. The brain requires steady blood flow and energy to function efficiently. If circulation is compromised, cognitive reserve may decline more noticeably when the body is tired. If evening confusion appears regularly, track when it occurs and how long it lasts. This pattern can provide valuable diagnostic clues. Number 6. Word-finding difficulties. Occasionally forgetting a word is normal. What's concerning is a repeated pattern of losing common words mid-sentence. A person may substitute related words, describe objects instead of naming them, or stop speaking abruptly because the word won't come. In vascular dementia, language changes may appear suddenly and fluctuate from day to day, reflecting inconsistent blood flow to language centers. Unlike gradual vocabulary decline seen in other conditions, these changes can feel abrupt and frustrating. If word-finding problems become frequent or worsen quickly, seek professional evaluation. Number 5. Difficulty following conversations or stories. This sign often goes unnoticed because hearing remains intact. The issue lies in processing. The person hears words clearly but struggles to connect them into meaningful context. They may ask for repeated explanations or lose track of a conversation halfway through. This involves working memory, the brain's ability to hold and manipulate information briefly. When vascular damage affects frontal brain circuits, the ability to track multi-step conversations declines. Family gatherings or busy environments may become overwhelming. The person may withdraw socially, not from lack of interest but from cognitive overload. Persistent difficulty following discussions should not be dismissed as distraction or disinterest. Number 4. Changes in depth perception or spatial awareness. This sign can be dangerous. The individual may misjudge distances, bump into furniture, spill drinks while setting them down, or hesitate at curbs and stairs. These aren't necessarily vision problems eyesight may test normally. Instead, the brain struggles to interpret spatial information correctly. Vascular damage to certain brain regions affects how three-dimensional space is processed. Sudden changes in spatial awareness increase fall risk and can affect driving safety. If coordination or depth judgment changes unexpectedly, seek medical evaluation immediately. Number 3. Subtle changes in walking or balance. This is one of the most overlooked signs. Walking may become slower, more cautious, or slightly unsteady. Steps may shorten. Turning may require extra concentration. Walking is not automatic, it requires coordination between multiple brain regions. When blood flow is compromised, motor planning becomes less efficient. One particularly telling clue is difficulty walking while talking. If someone struggles to maintain balance when distracted by conversation, this may signal reduced cognitive reserve. Because these changes can resemble arthritis or simple aging, they're often dismissed, but movement and cognition are closely connected. Changes in both areas together deserve prompt neurological assessment. Number 2. Emotional changes or loss of emotional control. Sudden mood swings may appear out of character. A typically calm individual may become easily frustrated. Someone emotionally reserved may cry unexpectedly. These changes can occur when vascular damage affects brain circuits responsible for regulating emotion. Emotional reactions may feel exaggerated or poorly timed. Families sometimes interpret this as personality change, stress, or depression. While those possibilities exist, sudden emotional instability, combined with cognitive changes, should be medically evaluated. Number 1. Unexplained urinary urgency. This sign surprises many people. Sudden urinary urgency without infection or prostate issues can sometimes reflect neurological changes. The frontal lobes help regulate bladder control. If blood vessel damage affects those areas, communication between brain and bladder may be disrupted. While urinary symptoms have many possible causes, when they appear alongside cognitive or movement changes, they should prompt comprehensive evaluation. What makes vascular dementia different? Unlike Alzheimer's disease, which usually progresses slowly, vascular dementia often worsens in noticeable stages. A small stroke or reduced blood flow may cause a sudden decline, followed by a period of stability. This step-by-step pattern is a key feature because it's linked to blood vessel health. Managing risk factors like high blood pressure, diabetes, cholesterol, smoking, and inactivity may help slow further decline. What to do if you notice these signs? Keep a record of specific changes and when they began. Schedule a medical evaluation promptly rather than waiting for symptoms to worsen. Ask about cognitive testing or brain imaging if recommended. Address vascular risk factors. Early timely action can make a meaningful difference in long-term outcomes. A final thought: not every memory lapse signals dementia. Not every balance issue indicates brain disease. But patterns matter. Sudden changes, stepwise declines, multiple symptoms appearing together. These are signals that deserve attention. Recognizing early warning signs does not create fear, it creates opportunity. Opportunity for intervention, opportunity for support, opportunity to protect cognitive health. If you found this information helpful, share it with someone who may benefit. Awareness empowers families to act early, and early action can change lives. If you have questions about vascular health or dementia awareness, speak with a qualified medical professional. Your brain is worth protecting.